Hello, my name is Gail Dakoff, and I'm going to introduce you to multidimensional family recovery, an intervention that addresses parental substance misuse and child maltreatment. MDFR addresses the problem that child welfare families with parental substance use have worse outcomes than child welfare families without parental substance use. And these worse outcomes include increased re-referral to child welfare, greater placement instability, longer stays in foster care, an increased number of out-of-home placements, and increased risk for termination of parental rights. The challenge is daunting. Treatment failure, child removal from the parents and other family members, and termination of parental rights are more the rule than the exception, even for specialized programs such as recovery coaches, nurse-family partnership, and Triple P. Looking at reunification rates among families with drug-using parents is an example of the challenge. Research shows us that less than 10% of children in standard child welfare programs are reunified with their families. Less than 10%. Less than 25% in specialized programs are reunified. And even in drug courts, only 40 to 60% are reunified. So then what does work? After reviewing 20 different intervention programs focusing on child maltreatment outcomes, a research review concluded that only 3 programs, including MDFR, prevented child maltreatment. A paradigm shift is required to improve outcomes. We believe that a move from strictly child-focused approaches to a more inclusive family focus that includes the child, the parents, and other family members is needed. Strengthening parents and families so they can provide a safe and healthy environment for their children is the best way to protect and nurture children now and prevent future child abuse and neglect. MDFR is built on these beliefs and principles. And we promote change in 6 domains: child functioning and safety, the self of the parent, their individual functioning, family relationships, intimate relationships, parenting and co-parenting, and then basic needs and resources. MDFR achieves changes in these 6 domains primarily through 2 large interventions: supporting and empowering parents and changing couple, family, and parenting interactions. Multidimensional family recovery is not a substance abuse treatment, nor is it a case management intervention, although some of its sessions are similar to sessions that might occur in substance abuse treatment, family therapy, and case management. So what are the essential interventions? Well, we empower parents. We interact with parents in a way that's collaborative and non-judgmental, and we provide total support. We help increase parental self-understanding through life review and other means. We help the parent know who they are now, who they were before the program, and who they want to be in the future, both as parents and as human beings. We challenge the parent's behavior and discuss discrepancies between who they want to be and current and past behavior. And we promote change in the context of authenticity and care. We'll involve the family in the intervention. We work to improve parenting practices and to improve family communication skills. Now I'm going to talk a little bit about what we do in each of the 6 domains. In the child domain, we're going to help the parent be on top of and know how to take care of their children's health and medical needs. We're going to screen for developmental lags and problems. We're going to link the child to services if needed and teach the parent how to access these services. We're going to focus on the area of daycare, childcare, and school, enroll if necessary, assess suitability, teach the parent how to be effectively involved in daycare and school. We'll visit the child care in school and just make sure that the child is thriving and receiving all the services they're entitled to. And of course, safety. We're going to do everything we can to promote a safe and healthy home and family environment. In the parent domain, we're going to focus on substance abuse and mental health treatment. We're going to enroll and retain the parent in treatment. We're going to advocate for them within the treatment program, coordinate among providers, and just make sure that the parents are not only attending regularly, but benefiting from the treatment. And in our interactions with the parents, we're going to support the treatment by enhancing the knowledge and skills that our clients are learning in treatment. We're going to help the parents take better care of themselves and address any health and medical concerns. We're going to focus on family planning and birth control and work to enhance parental self-worth and competence. If necessary, we'll help the parents with employment and educational opportunities, enhance communication skills, and improve emotion regulation and coping skills. Within the area of parenting and co-parenting, we're going to focus on parenting practices, of course. We're going to assess parenting practices, family structure, routines, roles, and improve them if necessary. We'll focus also on co-parenting if there's more than one parent involved, or parental figure, or more than one adult involved in parenting the children. We'll improve parental teamwork, reduce conflict if necessary, and work to improve communication and problem-solving skills. Within the realm of family relationships, we're going to focus on the family interactions, and if necessary, we'll try to reduce family members' negativity towards our parent and undermining of our parent as human beings and parents, and we're going to try to increase family member belief in and love for the parent. If necessary, we'll repair family relationships. In our families, there's often a lot of misunderstanding, hurt, betrayals, resentments. We're going to help them deal with those issues. And then we're going to help the family provide practical and emotional support to parents and children. In the area of intimate relationships, and this is a very important area, we're going to focus on relationship life review. It's something we do to help parents understand themselves better and to make healthier choices for themselves and their children moving forward. And then if they're involved in any intimate relationship, we're going to assess and, if necessary, try to improve that relationship. Basically, communication and problem-solving skills. And then finally, we have the area of basic needs and community. We'll work to reduce barriers to participation in substance abuse and mental health treatment, help families access all the service and resources they need, and help family members learn how to advocate for themselves. Currently, MDFR is being implemented in 3 separate sites. In Miami-Dade County Dependency Drug Court, where this intervention has been in place for over 15 years, I believe. In Miami Child Welfare, it's being implemented as part of diversion voluntary cases where they're diverted from court. In the Broward-Fort Lauderdale area, it's being used with judicial and non-judicial cases, non-voluntary, and the focus there is to prevent removal. And finally, in Connecticut, we'll be working soon with judicial and non-judicial cases and families where the children have been removed, as well as families at risk for removal. The overall goal of multidimensional family recovery is to change parents' lives so they can maintain sobriety, are adequate parents for their children, and avoid further involvement in the child welfare system. Thank you very much, and I look forward to working with all of you in the near future.